Welcome to the CIBHS webinar. Today's webinar will provide an overview of the Central Region's Partnership's Comprehensive Outcomes Report. This report covers almost 10 years of work in Central California, supported by MHSA WET funds. Now it's my pleasure to turn the presentation over to Director Kimberly Mayer.
Great, thank you so much, Jerry. And Jerry, do you want to put the first slide up there or share your screen, because I wasn't seeing that yet? So just to give you a little bit of background, the Central Regional Partnership is one of the 5 regional partnerships that were funded through the Mental Health Services Act in the statewide and regional strategies that started back in 2008. And these are the programs that are administered now through OSHPD, the Office of Statewide Health Planning and Development. Originally, these were funded by the Department of Mental Health. Let's go to the next slide. And what you can see is that within the 5 regional partnerships, each region really focused on their own goals and specific projects and the regional needs. The other regions include the Greater Bay Area, the Superior region up in the northern part of the state, the Southern California large counties, and also Los Angeles County. And what we're going to talk about today is the work of the Central Region Partnership. The WET funds were set aside for 10 years, and those funds are starting to sunset. So we wanted to make sure that we shared all the different accomplishments that have happened within the Central Region. And these are the 20 counties in the central part of the state. I'm going to be turning this over to Gina Eller, and Gina has been the coordinator for this project with CIBHS since 2009. She was hired first here as an associate and worked that way for several years. And Gina then became a consultant as she grew her consulting work. Gina is the principal of her own consulting company called GET Training Solutions. And she is also one of the national trainer of trainers for the mental health first aid program. She also has experience in providing training across California and the nation, as well as workforce development, management, and coordination and collaboration for the Central Region. She's also a lifetime trainer for the Bridges Out of Poverty program. Gina holds a bachelor's degree in business management and a master's of science degree in education and certificates in human resource management and online teaching and learning. So I'm going to turn it over to Gina, and she will give you some of the highlights of our work at the Central Region. So go ahead, Gina.
Thank you, Kim. Appreciate that. I would like to move to the next slide and talk a bit about how the Central Region Partnership started off deciding what we were going to do with the funds that were provided. We used stakeholder processes actually several times over our nearly 10 years together, and we focused on things that were priorities for our counties. The priorities were focused in several different strategies. Some were educational pipeline strategies, clinical supervision, which was really helpful for a lot of our counties. The skill development of staff and providers, and training of persons with lived experience, volunteers, providers, community members, and we had an additional goal of making sure that we were reducing stigma against mental illness in our communities. So all the projects and the programs for the Central Region are funded by the Mental Health Services Act through OSHPD, or the Office of Statewide Health Planning and Development. Placer County was the fiscal agent and used CIBHS to do fiscal administration of our work. Something to know about the Central Region is that it's comprised of 20 counties, but 15 of those 20 counties are small counties, which really kind of shaped why it was that we did the projects that we did. We have pipeline priorities that reflected the needs of our partner agencies. Some of those needs were being small counties or rural counties or counties that were distant from some of the universities that could provide education like social work programs or psychosocial rehabilitation programs. Rather, we contracted a number of different universities and colleges to do hybrid or online programs so that folks in our communities could learn more about psychosocial rehabilitation or social work and perhaps stay in their communities and grow our workforce in public mental health in our distant counties. Our training priorities reflect the needs of our partner agencies because we focused a lot on evidence-based practices for staff and providers, and we made sure that we could do as much as we could for people with lived experience. We were very thoughtful also about doing cultural competency type trainings or making sure there was a component of that in most of the trainings that we did. What we're going to look at next is each of the activities, or not each of them, actually highlights of some of the activities that we covered. This slide really reflects the pipeline priorities that we had, and the next slide is going to talk about highlights of some of those specific priorities. The roving clinical supervisor program was a big hit once we started. It was intended to help out counties in providing clinical supervision for individuals who were collecting hours for licensure, but we didn't limit it to that. We would allow anybody that needed clinical supervision in our counties to do that. The requirements to be included in that program were to be a member county of the Central Region, and to partner with at least one other county to share a clinical supervisor who would travel between the two counties and provide clinical supervision in those counties. As a result of that program, 200 clinicians have utilized the program, and about 50 people have become licensed as either marriage and family therapists, LPCCs, or licensed clinical social workers. Another 50 individuals have collected the required hours and are ready to take exams for licensure. So even though while the partnership was active, because we're kind of closing down having used our funds, not everybody became licensed. We were excited to know that we've also given folks a big push towards becoming licensed. And several of the counties that were participating in the roving clinical supervisor program continue to contract with some of their roving supervisors to help out those in their communities to, again, collect hours for licensure. Another program that was really helpful that we got good feedback from was our Rural Weekend MSW program. That program was started at Sac State, and it was really the beginning of our Central Region Partnership Funds, kind of one of the first projects that we did. 32 individuals enrolled and 26 graduated. 14 were currently employed at the end of that program, and the employment benefited the region's mental health services, with 9 working in public mental health at the time. It was actually started by a number of counties in our region kind of partnering and asking Sac State if we could have a rural weekend program. There are enough rural counties in California where we felt that a focus on rural needs and mental health would be helpful. And we found that was really helpful. And it actually blended really well when we started the roving clinical supervisor program. Many of the students that went through the Rural Weekend MSW program benefited from the clinical supervision program, and some actually received all their hours of supervision from this program. So the Central Region Partnership was real helpful for those individuals. Some other highlights of our pipeline priorities were the online psychosocial rehabilitation programs. We had 2 different programs at 2 different colleges in the Central Region. One was Modesto Junior College, the other was State Center Madera campus. And each one of those were hybrid or online programs where students would be able to do their learning online. MJC, or Modesto Junior College, also offered classes in person, and part of the program for them was really turning their in-person program into online as an alternative for folks. Because the Madera campus didn't already have a program, a psychosocial rehabilitation program, they started the program with a contract with the Central Region Partnership, and it was quite popular. So they actually ended out making 2 of the courses stateside or funded by the community college. So those programs continue to go on after our funding ended. During the financial support period, 77 Central Region students attended one of the programs, and the other one had similar numbers. It was just harder to kind of pick out which ones were Central Region for confidentiality reasons provided through the colleges. We had also a hybrid MSW program, and that was through an RFA process. We awarded $50,000 to CSU Stanislaus to help to develop a hybrid MSW program. In the first cohort, 23 students attended and were really interested in either working in or really interested in working in public mental health. One of the components of the program was to have a summer block placement, which made it challenging for some of our counties to be able to have employees participate. But we continued to have discussions with CSU Stanislaus to see if there were other options or possible options, and they continue to let us know that they'll try and do what we can, maybe on a student-by-student basis. Finally, the Central Region Coordinator work. That's the work that me and the fantastic staff here at CIBHS have done to support the Central Region Partnership in the different meetings, subcommittee meetings, and the administration of the programs and projects. A really big portion of what the Central Region Partnership was interested in doing from the beginning was to provide training. One of the reasons why is, again, with 15 of our counties being small counties, many of them didn't have budgetary resources to be able to obtain trainings that they might want that were evidence-based because of the cost of those trainings. So the Central Region Partnership spent quite a bit of funding and a lot of coordination, ensuring that a lot of training sessions were provided. Where possible, we tried to make sure that the trainings had sustainability options or training for trainer options so that the work could continue after the Central Region Partnership funding ended. Highlights of the training priorities, we did some community trainings. Our most popular by far was Mental Health First Aid, which is an evidence-based program. We trained over 200 instructors in our 9-year program. We actually started with Mental Health First Aid in 2010. And because of the efforts of those 200 instructors, we've trained over 25,000 community members in the Central Region to be mental health first aiders, and we're proud of that. And many of our counties continue good and strong work with the Mental Health First Aid program, citing that community members really appreciate it, that it's lowering stigma and it's building goodwill between the county agency and the communities. There were a number of peer trainings that were offered. A RAP was one of the ones that was really popular. A lot of our folks were really interested in it, really enjoyed the course, and also a sustainable training program where folks are able to go back out to their communities and provide RAP, wellness recovery action planning training courses or group sessions. Another training or some other trainings that were really popular were some of our clinical trainings. Seeking Safety was another evidence-based program that we delivered to over 100 participants. Screening, Brief Intervention, Referral to Treatment, or SBIRT, was another evidence-based program that we delivered to nearly 100 folks in the Central Region, some of our clinical staff. Same with ASSIST, or Applied Suicide Intervention Skills Training, and Trauma-Focused Cognitive Behavioral Therapy. And again, these were well received, and many of our participating counties would not have had the opportunity to allow or have their employees or staff attend these without the funding of the Central Region Partnership. Additionally, we provided leadership trainings, and leadership trainings included recovery-oriented leadership, creative problem solving. We sent a number of folks through the Leadership Institute that is a partnership between University of Southern California and CIBHS, and that was for a number of folks, and it's executive focused often for directors when they become directors or are aspiring directors. We also contracted with UC Davis Extension, the Center for Human Services, for a number of leadership training series and a training for trainers so that participants who attended that course could go back to their counties and provide leadership training there. Finally, we also provided a number of cultural and interpreter trainings. We contracted with the mental health interpreter training for interpreters, so again, sustainability in mind, and training for providers who use interpreters in mental health settings, and also provided a couple of national culturally and linguistically appropriate services standards training sessions over the last couple of years, just getting folks maybe more familiar with the NCLAS standards while they're preparing to complete their cultural competency plans. Another big project, or a couple of projects that we did, were some conferences and other projects. And the highlights from those are the Cultural Competency Summit 13 was sponsored in whole by the Central Region Partnership. We served about 300 participants from all of Northern California. 64% of the evaluation respondents self-reported being of an ethnicity other than white, which for the demography of Northern California, I think that's really important to state. We provided a TAY unconvention, or transitional age youth unconvention, where 150 transitional age youth from our various counties came together, networking and really talking about empowerment, advocacy, employment strategies, and other helpful things to them. We had a website up for them to continue to connect and network afterwards, but that ended not long after that, and my guess is that's because our transitional aged youth are much better at connecting with each other than going to a website provided by the Central Region Partnership. We also sponsored participants to attend the Together Against Stigma conference, and that was a number of years ago, and it's an international conference, and it was reported that they really appreciated what they had learned there, and also brought back some of the skills that they'd learned or tools that they'd received to use them in their counties. And finally, another project we did was a webinar and a guide for after rural suicide, a postvention guide, and that's still posted on the Central Region Partnership website for folks that are interested in that. And it was intended to be helpful for communities that in rural settings that might experience a suicide in the community that has a ripple effect, and how to prepare for that not being as challenging as it can be without a plan. So it really is talking about a postvention plan for communities. So in conclusion, the Central Region Partnership has successfully utilized funding to provide pipeline training and other prioritized activities to benefit those that are living in our communities with mental health conditions. Our pipeline projects have provided educational opportunities to staff, to peers, to partner and provider agencies in our communities, to be able to hopefully provide access in ways that they might not have been able to get or obtain without the sponsorship or the support of the Central Region Partnership. Our training projects have provided professional development, skills building opportunities, most of them being evidence-based and others geared towards recovery or consumer, family, caregiver, and peer trainings. And the partnership also sponsored several trainings and conferences geared towards improving cultural humility towards those who are underrepresented in our communities. So we're really proud of what we've done over the last 9 years, and really want to say thank you to CIBHS for supporting the Central Region Partnership over this time. I also would like to thank Placer County for fiscal administration and the guidance that was provided primarily by Maureen Bauman for a number of years as our chairperson, and also John Lawless, both now retired. But I also wanted to thank folks for the opportunity to be the coordinator for the last several years. It's been a great honor.
thank you, Gina. And it's really exciting to hear about all that's been accomplished. A couple things that I guess a couple of really important points to message to deliver here is that what I think the work of the regional partnerships really demonstrates, and especially in the central region, is that workforce development is something that crosses county lines, it crosses city lines, it crosses county lines, and especially in the public mental health, the public behavioral health system, counties alone generally cannot do these things, and that's why this regional focus has been so helpful. And I also just want to point out how different regions are, as we know in California. The focus on the needs of rural counties has been a really important focus for the central region, especially the rural MSW program. And for those of us who work around workforce development and behavioral health, we know that we have a maldistribution of where clinicians are and master's level people and other behavioral health professionals throughout the state because of where education and training programs are. They may not be there's not as many, for example, in the Central Valley as there are in either the Greater Bay Area or Southern California or the Sacramento area. And so I think what you really see here is what the needs of the region were and how this is one way to really grow their own workforce, to really develop skills and to really build a workforce in the central region. So we feel really proud of the work that all the 20 counties who have really contributed and the directors of all the 20 of the counties that also allowed their staff to be able to participate in different things here. So we're going to turn it over, and so Jerry, do we have any questions? And if you have a question, you can also type it into the chat box right now. So Jerry, are there any questions?
I don't have any questions at this time.
I would like to mention, though, and I think we've said it already, but it's important to note that we will have a more comprehensive outcomes document that in detail provides a lot of data about every single project that was done in the Central Region Partnership since 2009. That document, again, is provided as part of this webinar, and it will be posted on the CIBHS website and the Central Region Partnership website.
Yes, you can find this outcomes document under the handouts on your control panel.
Great, thank you so much. So we'll wait a couple more minutes to see if we have any questions, we'll just wait a couple minutes here. So Jerry, it looks like we don't have any questions. Is that correct?
That is correct.
All right. So with that, I think we're going to end the webinar today. I want to thank everybody for participating and reviewing the report. And if you'd like any more information, there is an email address for CIBHS on the website on the last slide. And we want to thank you. We're going to conclude our broadcast, and thank you so much for joining us today.
Thank you.
Yeah, thank you for participating in today's webinar, reviewing the Comprehensive Outcomes Report from the Central Region Partnership. If you'd like more information, please type that into the questions box and we'll set up a time to discuss individually. With that, we'll conclude our broadcast. Thank you again for joining us.